Dr. Albert. Yeah. So in South Florida now, I see so many people with red eyes and congestion, and they said the pollen concentration is high. Is that right?
Yes.
This is the season?
Yeah,
okay.
It's pretty bad here in South Florida too.
Because I was thinking it's only I came from Boston, so they usually have spring. Is it spring now already?
It's pretty much the start of spring.
Okay.
But it can also be kind of year round in Florida since it's tropical.
Okay.
It's very tropical. So
we
have.
So the allergy in Florida is also pretty popular. I didn't know that. And the allergy usually, it's not like everybody has symptoms. You don't have symptoms. I sometimes, the past couple of years, I started having like runny nose. I don't have congestion. And I think with the age, the immune system tend to get out of balance. So if I eat some nuts for 3 days, if I eat some cheese, and then induce the histamine, and my body, my immune system would be response to those pollen, to cold or something, nuts, and strongly with a runny nose. Sometimes I even feel ear ringing. So that's high histamine. I wasn't as sensitive, but I try to avoid all of this for years. I didn't get rid of that. If I test with those, I may not be allergic. It just brings up my histamine level, and then I would have some reaction. So what's your opinion?
Yeah, I mean, I think depending on the pollen levels, anybody can have issues with allergies. Some people are definitely more sensitive than others. When you talk about like sinus allergies, there's certain supplements and herbs you can take that can really help counteract that response, the inflammatory response that the body has. So one very interesting one that I found recently is on spirulina, which is a type of algae. So spirulina can really help stabilize mast cells. They're the type of immune cell that releases histamine in response to allergens.
Yes.
So if you take, the study showed 2 grams of spirulina taken every day was significantly more effective than placebo over 6 months. And there was another trial showing that it was even more effective than Zyrtec, the 10 milligram dose of Zyrtec or cetirizine over 2 months. The spirulina, 2 grams.
Oh, that's good to know. So it's actually blocked the mast cell, right, to release the histamine.
Yeah.
How about do you have patients who take antihistamine like Benadryl or Zyrtec?
Sure. Do you have a lot of patients take those medicines? A lot of them. So some of the antihistamines are targeted for like sinuses, allergies. Some take them for acid reflux too, like Pepcid or famotidine, right?
Yeah. So what's the side effect of long term? Let's say, I think that related with the allergy is more like H1 receptor, which is the Zyrtec or Benadryl. If people take that long term, what's the side effect?
So especially Benadryl, people can have memory issues. So if you take Benadryl often or daily, it can cause you to forget things, especially have issues with short-term memory.
Okay, because the histamine really kind of make the nerve more active. If you block that, you not only those nerves are not active, but also maybe it influences the blood flow to the nerves. Yeah,
I'm not sure, but it also causes a lot of drowsiness, right?
Yes,
so drowsiness is a big side effect. And so that's why people have now been taking like Zyrtec, cetirizine, or Allegra, or other ones that are less, they have less of a drowsy effect, but they can still cause some drowsiness and some similar side effects.
Yes. And also the older and younger people respond differently.
Yes, absolutely.
Yeah. I think when I get older, if I take one Benadryl, usually it lasts like 6-7 hours drowsiness. And once I'm up, and then I will, after 1 hour, I'm fine. But my problem is if I take any medication, it only works for 2 days. The third day, my body just does not respond unless
Right.
Yeah, so the tolerance, I
Right.
think it's changing when you get older.
Yeah, and that's a common issue, tolerance, where people need higher doses to get the same effect. And then people take these medicines for the long term, and then they don't know if they're any better than when they first started in the beginning after a while. But then they're kind of stuck because when they try to come off of the medicine, they get rebound symptoms.
Yes.
And they think that their symptoms are actually worse when it's really related to the medicine that they were taking.
Yes. So any medication, long-term use always have some side effect.
Yeah, and they're not, it's really intended for short-term use or for bursts of use, like especially the medications for the stomach, like those aren't intended to be taken for more than 2 weeks, and that's what it says on the labeling. But many people take them for years.
Like Paracet, right? It's such a strong medication, and I talked to Dr. Hart. He already retired. He said we never use that for long term, back to old time, because if you block the acid, then you wouldn't digest protein and the minerals, right?
Right, you don't digest as well. You let more bacteria through into the intestines because they're not getting killed off. The acid's weaker in the stomach.
Yes. So I think the allergy season, the preventative, you are mentioning spirulina,
the
herbs.
Quercetin can also help, which is a flavonoid in a lot of vegetables. So eating more vegetables even could help.
Right? Yes.
And butterbur is another herb that can really help. Butterbur, but it has to be taken more often. So the study showed that butterbur and I think it compared it to cetirizine or Zyrtec again, they were equally effective, but the butterbur had to be taken 4 times a day instead of once a day for the cetirizine. It just didn't have the drowsy side effect that cetirizine or Zyrtec had though.
You said cetirizine?
Yep, cetirizine is the generic name for the drug Zyrtec.
Oh, Zyrtec. Okay, I'm thinking, yes.
Because some people know it as the generic because they only get the generic.
Oh, okay.
And some people know it as the brand name. So.
Oh, okay. Which one is better, brand name or? Because I always.
Well, I think brand name's typically better, but it really depends. It could be expensive, and it depends because there are multiple manufacturers for each generic.
Yes.
Each generic is not the same because it depends on the manufacturer.
Oh, okay. But it's the best way is not taking that and just change the diet.
Changing your diet and lifestyle and putting like a HEPA filter in your air conditioning or in your house to help filter out a lot of the pollen and allergens in your environment.
Yes. What kind of filter you use?
I use one of the Koei Air Mega HEPA filters. I actually have 2 of them in the house, and they're just kind of running all the time on this eco setting, so it can filter out pet fur, dander, different pollens or allergens.
Yes, and the other thing I tell people is, you gotta take shower before you go to bed, because for allergies there's acute stage, there's a later response stage. So the acute stage happen within a short period of time, half an hour, but then later stage, then if you don't take shower, any pollen or any foreign material stuck on your skin and just be there for 12 hours.
Right, they can keep re-triggering the allergic response. Yeah, and also the steam of a shower can really help open up the sinuses, right?
Yes. Thank you.